After a long time, my medical faculty, who is Dr. Vijaysekara, who is now leading consultant nephrologist working in US, UK. Coincidentally, he came to my clinic and my home today. We have a chat with them, and so I'm a very good friend of him, and a lot of entertainments we jovial with him. We would like to get some information from our community purpose. So I think he will give it to our public. Anyway, my doctor will take care.
Hi, Dr. Vijaysekara. It's a pleasure to have you around here today, and I think being batchmates along with my dad from the Faculty of Medicine at Colombo University, it's a pleasure to see reuniting of bonds which defines good relationship. And so I think today we do see, as you are one of the leading consultants in nephrology department in UK, in Manchester, it is vital to know that after cardiac and cancer department, we do see chronic kidney diseases increasing. And what could we do in order to prevent or reduce the chronic diseases in the kidney arena for patients especially?
The most common causes of kidney failure are diabetes and high blood pressure. Unfortunately, these two problems are not curable, but you can control, manage, and unfortunately it has to be lifelong treatment. So, if you adhere to what the doctors tell you and follow their advice and take your medications regularly, stick to the dietary advice, and then if you control those two, blood pressure and blood sugar, you can prevent all these complications, especially kidney failure. Unfortunately, in reality, we all are human beings. Most of the patients are not 100% compliant, and then people end up, despite all the good advice, in kidney failure.
Yeah. So certainly we do see that this is more certain in patients above 50 or 45 above, mostly because diabetes, but obviously now youngsters also do pertain to get. But if they are to get like above 50, and so something around like where they come to a position where the diabetes or high blood pressure has been quite long, for persistent long time, and then there's option of kidney transplant as well. So do you recommend, obviously getting a kidney transplant is hard, but would that be an option, or?
It is an option not for everybody with kidney failure. It is for patients who have reached what we call end-stage kidney failure. So that is a very advanced kidney failure, usually requiring dialysis. So for those patients, yes, transplantation is the ideal treatment. Unfortunately, everybody has no access.
Yes.
Even dialysis in this country.
Yes.
So I would still emphasize, make sure you control your diabetes and high blood pressure to avoid getting kidney failure. So, because those are the two common.
And what is any diet that a normal person could take when they're along with diabetes? Would be intake of more fluid, water to keep the osmotic regulation, or?
In general, patients with kidney problems, we advise not in advanced kidney failure but moderate to mild degree, avoid dehydration. It's about striking a balance. Too much water is also not good, you end up retaining water. So in this country, probably if you have mild to moderate kidney failure, probably 2 liters of fluid intake at least. Particularly when it is very hot, or if you have diarrheal illness, make sure you drink additional water to make for the loss of fluid through the stools, sweating or vomiting.
Right. With regards to, I think the youngsters, it's not much more common as of before 30s or something like that. So for them, it's just about making sure to keep their diabetes, if they are
keep to healthy lifestyle.
Yes.
Yeah, so don't put on excessive weight. Yeah, so look after yourself.
Right.
Because if you are overweight, you tend to have this problem, diabetes and high
Yes.
blood pressure.
Yeah.
Not only that, it is a risk for the heart as well.
Yes. And the last question that I just wanted to ask was with regards to the kidney patients is sometimes they do mention dialysis helps to keep them for quite long, but in reality is that something that can actually take over the kidney, which is not really, but maybe 60%, or is that just an alternative treatment to just go on?
Herbal treatment, you mean?
Yes.
Yeah. Herbal treatment, probably I wouldn't recommend if I were.
Yes.
If it was for my mother or myself,
Yeah.
I would recommend, because simply some herbs are known to cause kidney damage. Yeah, so we don't know what these herbs contain,
Yeah.
their chemicals.
Yeah.
So and in addition, especially if you are a kidney patient, they tend to have high potassium, they develop high potassium, which can be potentially life-threatening. So these herbs, they are coming from plant, they have
Yes.
high potassium content. So you can end up having trouble with high potassium, which can be very fatal.
Yes. So thank you, doctor. I think it's.
I wanted to ask you from you that regarding the nutrition supplement, what is your suggestion for the creatine patients, high creatine, and the diet advice also generally, what should take care about this?
With regard to creatinine, we are not much bothered, because high creatinine, is coming from muscle breakdown. It's a byproduct of muscle breakdown, which is only serving as a marker of kidney failure. So that's how we used to calculate the GFR. So creatinine per se is not very harmful to our body. So we don't advise any dietary advice regarding the creatinine, but in general, as I said, memory is the potassium and phosphate in moderate to severe kidney failure patients. We do advise them to avoid to have in moderation if you are if you eat a lot of fruits.
You know that there are some general view of Sri Lanka that fruits name called custard fruit, then fruit, another one, it's kind of fruits also they are saying is stuff to take, some fruits are allowed to take. So I won't know whether what fruit is advisable, not advisable.
In general, all the fruits, this is only for advance if you are running into hypertension problem. Fruits in moderation, particularly bananas, avocado, grapes, and dates. I think are very popular amongst your community. And the other one is the fruit juices, which are concentrates of fruit, so they are very high in potassium. So that is with regard to potassium. In addition,
Another fruit, what do you think about
another, again, I'm not, because it is particularly local and not very common fruit. I would say probably it has high potassium, knowing the other fruits have.
But some of the doctors are saying you can take it a little bit.
Yeah, in moderation, everything it should be in moderation. I wouldn't say totally, occasionally you can enjoy it.
Watermelon?
Watermelon, yeah, again in moderation, but...
so you are saying according to your knowledge, your moderation is
moderation, yeah. But some patients are especially prone to develop this high potassium problem. not everybody, but those patients. who
Okay,
take
that
blood-
point is I agree. What about the high chemical drugs, which is strong drugs, can affect your kidney or not?
Well, there are non-nephrotoxic drugs, particularly some antibiotics like famous is gentamicin.
Painkillers.
Painkillers commonly used is non-steroidal anti-inflammatory things like brompheniramine. They are very good painkillers. Not everybody ends up in having kidney failure, but if you are a kidney patient, then we recommend it if you have no kidney problem, you have.
Do you think it's some genetics are involving on that?
Not so far. We haven't found any genetic.
Yeah, that's what we won't know. So sometime that the father had a kidney failure and the family runs on that way, it's not common.
It is not common. Of course, there are familial kidney disorders. Well known is polycystic kidney disease. But of course, there are rare syndromes which still we are learning about. Some syndromes are being described. Have been described.
But generally, your opinion is a high dose of the drugs. It's try to avoid is much better.
Yeah.
So go for the nature life.
Yeah, nature life.
Life and diet and diet and style.
Yeah.
And exercise and
Exercise.
mind, spiritual
Oh,
relaxation.
yeah, relaxation and mental health is important.
Food also main part playing on the role.
Food, if you are mainly if you have
Fast food is not advised.
No, the fast food problem with fast food is most of these fast foods are very oily. They have high cholesterol because patients with kidney failure are prone to they have high lipid levels. So they are very high risk of strokes, heart attacks, patients. So you have to avoid high cholesterol content food. And other thing is the fast food, mainly they have been preserved and frozen. So they have a lot of additives as food preservative. They have very high content of phosphate, which tends to accumulate if you have moderate to severe kidney failure.
One question I want to deeply to be understand from you. You are living in a Europe country, and the frozen food, which is mostly food or eating item. What do you think about it? Is advisable to kidney to
We would generally
fresh is much better.
advise to avoid because one is, as I explained, they have high phosphate content because of the additive, and they have high salt content because that's how it is again as a preservative.
No. The point is that most of the chicken and the hot dogs and the beef, mutton, that the European countries frozen is the most prone to this protein level to be increased. There's a lot of chances.
Not. It's not the only option there. In fact, the fresh meat are probably cheaper. The only thing is you have to buy and cook them. So, but people choose the easy way. They don't go for the fast food. You just eat it for microwave. But if you buy fresh meat and cook,
much
better because they don't have additive. They don't have a lot of salt. So.
I think, thank you very much, my colleagues, having a very nice few minutes interview. So what is your suggestion?
Yes, thank you, doctor, because I think as nephrology, it's very common and it's very vital to let others know as well, and even the youngsters, and being one of the leading causes, and what we can do in order to prevent. So thank you so much for taking our time and also visiting us, and all the way from UK. It's really nice to see, and yes, thank you.
Thank you.